Okay. Good afternoon, everyone, and welcome to a special event today for the in-house seminar. So actually today we are called Wednesday SEA Mobilities Seminar Series. And my name is Patrapon Jinglasili, your host today. And I'm happy to announce that today we have the first seminar under the Wednesday SEA Mobilities Seminar Series. The Wednesday SEA Mobility is the seminar series jointly organized by IPSR in-house seminar at Mahidol University and Mahidol Migration Center, or MMC, and also the SEA Junction. And the main focus of this series is around the topic of the migration in Southeast Asia. We aim to bring people in the field of migration and Southeast Asian studies together to present their research and to discuss and share opinions on migration-related issues. And the event will be held bi-monthly throughout this year, 2022. So next time we will be organized in April. Before we start, I would like to invite Associate Professor Rosalia Ciotino, founder of Executive Director of SEA Junction, to say a few words about this collaborative efforts. And please, may I invite Ajahn Rosalia, please.
Thank you very much. And indeed, as Ajahn at IPSR and as founder of SEA Junction, I am particularly glad that finally we are collaborating in a very important program. Just a few words about SEA Junction. It's a public venue based in Bangkok and focusing on all aspects of Southeast Asia. Recently, we have given a lot of attention to Myanmar, which for sure will be also related to the topic today, but also we have given attention to migration, and therefore it makes a lot of sense for us to collaborate with the leading institute on migration in Thailand, IPSR, and explore more all the dimension of migration in Southeast Asia, movements, not only migration. So we will also focusing on refugees and trafficking and other aspects of mobility. So thank you very much to IPSR for including us in the Wednesday seminar, and I look forward to collaborating in the future. Thank you.
Okay, thank you very much, Ajahn Rosalia, and also thanks for your kind collaboration and support for this event. And actually, I also would like to thank Ajahn Sirada Khemanitthathai, Associate Professor Sirada Khemanitthathai. I'm not sure she's here yet. I'm not seeing her. She's a Deputy Director of International Relations, Networking, and Academic Service at IPSR, who brought us together and supported this event. So today we are honored to have Ajahn Sirada Khemanitthathai. She is a new faculty member at Chiang Mai University to present on her report, which supported by Humanity United and Migrant Working Group. It's titled Situation on Migrant Workers and Border Crossing During COVID-19 Pandemic. Ajahn Sirada Khemanitthathai is currently a faculty member at Faculty of Political Science and Public Administration, Chiang Mai University. And she has finished her PhD from the Department of Politics and International Studies at SOAS, University of London. And her research focus is on cross-border migration between Thailand and Myanmar, transnational politics, state policies, and also human rights. And she also had experiences working in a non-governmental organization on human rights, and was a founder of a Burmese language school in Bangkok as well. And as usual, we will have 30 minutes for presentation, and also we have 30 minutes for Q&A. We are now live on both IPSR and SEA Junction Facebook pages. So those who are on Facebook can post your comments and questions in the comment section, and the team will forward them to me. Or those who are on Zoom, you can type in your questions and comments in the chat box, and we will be able to ask questions after Ajahn Sirada has already finished her presentation. So I'd like to invite Dr. Sirada to present her report, please.
Yeah, good. Hello, good afternoon, everyone. I'm sorry for that. I cannot share the screen by myself, so I need maybe I have to say next slide or something that might disturb you. So basically, like let me introduce myself first. My name is Sirada. I'm from Political Science and Public Administration, Chiang Mai University. I'm a new, as Ajahn Patrapon said, I'm a new member of this faculty. And but this report I did before I started my career. I had a full support from my Migrant Working Group. Next slide, please. So this report, as you see, so this talk is based on the report publishing in November 2021. So I wrote this report with a collaboration with Migrant Working Group. This NGO network is specifically works on migrant working issues, and you can see, if you haven't heard about this migrant working group, you can go to their website and you can see a lot of publications regarding migrant worker situation in Thailand. And for this report, I like to give credit to several people, including Kun Rosai Wongsuban, Kun Adisorn Gertmongkol, and Kun Koriyot Manushare for their full support as well. And you can go download the report both in Thai and English version from the MWG's website, as I put in this slide. Next slide. And so to start, I like to talk about the factors why migrant workers in Thailand are at high risk of COVID infection. So the second wave of the COVID pandemic in Thailand, starting in late December 2020, saw huge cluster transmissions among Myanmar migrant workers in Samut Sakhon, which is the center of many factories, which hire a lot of Myanmar migrant workers. So migrant worker became a central attention among Thai public. Mostly like Thai public kind of like stigmatize and blame migrant workers at individual levels for kind of, as for example, like why migrant workers don't wear masks, why migrant workers don't do that, don't prevent themselves, something like that. This is what actually really happened back then and during the second wave of COVID pandemic in Thailand. However, there were actually several socioeconomic factors that really cause why migrant workers be at higher risk of getting COVID. So basically, I try to say like we cannot blame them only at individual levels, but because there are so a lot of factors that they themselves cannot really control. So the firstly, like migrant workers usually share room with their friends who work in different shifts. When the COVID-19 outbreak began, the situation getting worse as they were forced to live together because they were jobless, so they had to stick together when they were jobless, and they could not like work in different shifts, so they had to live in overcrowded dormitories, for example, and then that means that social distancing was impossible, and also like many of their accommodation were also found unhygienic. And secondly, like migrant workers usually work in large groups, in factories, in markets, in fishing boats. So it's impossible for them to do social distancing as well. And as you see, like the outbreak were started at markets and fishing boat first before like spreading to factories and small factories and then large factories later on. And lastly, like migrant workers also lacked access to healthcare and preventing tools, because these tools and this healthcare somehow like they were too expensive when compared to migrant worker wages. So they couldn't really afford some preventive tools, for example, especially like masks. And then during the outbreak, sometimes like some places these preventive tools are out. They like lack of resources as well, that they cannot find a place to buy. And next, please. So as Myanmar nationals were suspected to be being the center of the spread of COVID-19, so they were tracked for the sake of the pandemic control. That made them the largest proportion of coronavirus infections. So of the total infections nationwide, 61.6% were Myanmar national during the second wave of COVID-19 in Thailand. As for the proportion of infections among three nationals, including Myanmar, Laos, and Cambodian, their infection cases accounted for 62.9%. Next slide. And the third wave of COVID-19 began on 1st April 2021, as the situation of COVID-19 outbreak in Thailand was severe and occurred among all groups of population in Thailand. So we could see like the percentage of migrant workers or of three national migrant workers became really low, as only 8.3% of whom were migrant workers from Myanmar, Laos, and Cambodia were infected when comparing to the total nationwide infections. However, the unofficial count may be higher, much higher, because some recorded number of confirmed cases didn't show the nationalities of the patients. So insufficient data caused some uncertainty in this statistic, to be honest. And next, please. So in my report, the statistic that put in the report ended at the end of October 2021. So I updated some data to this slide, and you can see that the trend of the infections, the number of the COVID infections starts to rise again. So I think even the report was published several months ago. I hope this talk is still useful, as all of us can see the problems, the existing problems, and can help find solution and prevention, not to repeat the same problems that used to occur in the past again. And you can see like we have to be aware of as the infections in Thailand in general has already started rising. And I put November, December, January, and February statistic as well in this slide. So I think so that's why I think it's still timely to think about what we can do in the future and now. Okay, next slide. For the fatality rate, 401 there were from April 2021 to the end of October 2021, there were 401 fatalities among three nationals, which account for 2.1% of total number nationwide. You can see like around July 2021 until September 2021, there were many more Myanmar, Laos, and Cambodian people died from COVID. But it's also like it's parallel with the nationwide fatality rate as well. Okay. Next, yes, okay. According to policy level, for the regarding access to public healthcare services, according to the policy level, the Thai government has provided migrant workers access to medical care, including screening tests and subsequent treatment, no matter whether covered by the health insurance or not. However, in practice, there were an insufficient amount of medical resources, especially during this, the third wave of COVID-19. I mean, like the early stage of the third wave of COVID-19 in Thailand. So the resource mismanagement and the top-down cumbersome bureaucracy had resulted in racial discrimination on the ground. I mean, on the ground, because at the policy level is not, it wasn't really appear significantly, but in practice and on the ground, there's many cases reported about the racial discrimination. For example, like sometimes the officials did not fully understand or even reluctant to provide healthcare assistance for migrant workers, because like many infected Thais hadn't received treatment. So these officials would choose to service Thais before foreign nationals. And the case on 5th July 2021, the letter issued by the Department of Employment stated the proactive COVID-19 testing for workers from 3 countries had been put on hold. So the department's Director General claimed that the active testing was on hold because of insufficient resources for general patients and overlapping authority with the Bangkok administration. Besides, racial discrimination was reported in late June as well, when the pre-admission center claimed that a signboard in front of the building saying that we do not accept migrant workers was installed after the employees abandoned their workers without asking permissions in advance. So even though the center looked after many migrant workers, the signboard stirred worry that the order of healthcare service would be delivered based on nationalities. Next. And for the vaccination is getting like, you can see the number that is getting, that foreign national can get more vaccine more and more when the time pass. And the next one, the next one is the latest statistics as well. And next slide, for the next slide is the, I like to say about the channels for migrant workers to get vaccination. So for documented migrant workers, the government has issued clear regulation for them to get vaccine. The policy for undocumented white migrant workers and followers, however, remains unclear. And all the loopholes are like can be plugged by the local administrations and civil society organizations in state. So basically, like the vaccine policy for migrant workers vary from one province to another one, or one local authority to another. Migrant workers in tourism hub areas got the vaccine before others, followed by those in high-risk areas, especially Bangkok, and then the race came after that. And moreover, like business sector also had a prominent roles in providing migrant worker vaccines. And more details you can see in the report, like how the business sector involved with helping migrant workers to get vaccination. And for undocumented migrants and those with ambiguous status, civil society organizations stepped in to help. So in Bangkok, there was a cooperation between Thai Red Cross Society and Migrant Working Group to search for migrant workers and stateless people who hadn't been vaccinated due to the regulations and laws. And both organizations received vaccines and drew donations and set up vaccination centers for those undocumented migrants. And similar cooperation also found in Mae Sot and Chiang Mai as well. Next. For social impacts, migrant workers are not for social impact, migrant workers are one of the most vulnerable groups economically and socially. They find themselves living in limbo during the COVID-19 pandemic. So the crisis has compounded the challenges the workers face from pandemic and the government policies, pushing them into further vulnerability. They directly were impacted on jobs and income. They are also at risk of being deprived of social security benefits. But one thing that I like to highlight here is there were several times that Thai authorities and media and Thai media reproducing the otherness of migrant workers. So there were cases of an official page of Thai authority saying that no Thai people were found infected, but only foreign nationals in immigration detention centers during the first wave of COVID-19 in Thailand. So this statement contained in the picture is this statement contained happy tone to emphasize the pureness of Thai nationals who were COVID-free, while foreigners were importers of the disease. Also, the Thai media also reproduced similar kind of otherness of migrant workers through discourses that portray Myanmar people as enemy who threaten Thailand's security by bringing COVID-19 into country. For example, some headlines that I found during the second wave of COVID-19 in Thailand include, for example, like, we are worried about COVID-19 war that Myanmar is now attacking Thailand, or Myanmar COVID has already been approached to our capital, or historically, Burmese army sieged Krung Siriyuthaya for 14 months before successfully attacked, but now Burmese only pay 10,000 baht and Thais would pick them up to destination in Thailand. So meanwhile, during the second wave of COVID-19, a lot of Thai netizens' opinion were found negative and violent towards migrant workers. So their online opinions were very stereotypical and contained a hard threat toward migrant workers. And next. In coronavirus outbreak control, migrant workers have been targeted for control and limitation of movement, whether in residential area or in workplace, or in large-scale level like a policy prohibiting migrant workers to travel across provinces. Implementation of these measures are embedded with discriminations, as many implementations have been exclusively enforced on migrant workers, but not Thai people. When a migrant worker cluster was discovered in late December 2020, Samut Sakhon province announced the immediate closing of shrimp market and the apartment that migrant workers stayed. And also put the barbed wire as shown in the photo at the entrance of the apartment. After that, many similar measures were adopted in the area of virus spreading among migrant workers. For example, there was a closing of building at the Bang Yai Central Market in Bang Yai district in December. Before the end of December 2020. And another case was in Rayong in the middle of July 2021, in which military and administrative staff with rifles guarded the entrance of mansion where migrant workers resided. And the measure of no movement of migrant workers is a measure that most targeted at migrant workers, and it was nationality-based discrimination because Thai workers could still travel at the same time. So to conduct this measure, security institutions and police put on screening blockades and to forbid migrant workers to travel across provinces. Next. So COVID-19 brought additional problems to migrant workers' legal status, as shown in the infographic in this slide. So the border closure policy had consequences. Workers in neighboring country who wanted to work in Thailand had no choice but smuggling, resulting in a lot of migrant workers without legal status. And then the next one is like, because of economic situation during COVID-19, some migrant workers were fined or could not find permanent employers. So that problematized their legal status. And the other consequence is that the job and income instability due to economic situation during the severe COVID-19 spreading caused some migrant workers managed to go home temporarily and smuggle back to Thailand as well. This affected their legal status and document. And next, please. And so in managing migrant workers during COVID-19, Thai government emphasized on some measures extending the deadline and regularize undocumented migrant workers by using the original ad hoc mechanism, which is the cabinet resolution, so that there has been no long-term policy on managing migrant workers in Thailand, as you may know. So the measure aims to delay the import of migrant workers and alleviate labor shortages faced by employers in Thailand. So it is clear that policy implementation on migrant worker status management during the COVID-19 often relies on economic reason of labor shortage. So key actors who have been pushing labor demand related policy and pressuring Thai government include Chamber of Commerce and Board of the Trade of Thailand and the Federation of Thai Industries. So you can see their roles in mentioning the labor shortage, and that try to push that every worker group should given the legal status and then put in the system and also be vaccinated. And then like after that, like the importation of workers through MOU mechanism was later considered. So it's just still like, it has been considered like for many months ago. And it was considered because of the demands from private sector. And then the demand pressured the government to reconsider using MOU mechanism. And next, please. And the main request of the private sector came from the labor shortage. In the middle of 2021, there was a statistic conducted by the Department of Employment showing that the labor shortage got more severe. So it was found that there certainly were demands of 424,000 migrant workers, in which around 250,000 were Myanmar. And the business that demanded migrant workers most were agriculture, livestock, and construction, service, agricultural industry, and textile industry. And you can see in the statistics shown in the slide that I think like the number was in the middle of 2021, but I'm sure like the labor demand has been increasing as now Thai economic has opened more than what it did in the middle of the last year. Next. And the last point I want to discuss is the smuggling across border. So you can see the statistic that I already updated in this slide. So it's slightly different from the report published in November, because I update the trend in the statistic in November, December until now. You can see like in January there were a lot more people who cross border through informal channels and got arrested by Thai authorities. So actually, like the smuggling across border have been happening in different ways. They include looking for jobs in Thailand, using Thailand as a transit, migrant workers returning home, Thai people coming back to Thailand, and Thai people smuggling to work in neighboring countries. So basically, like smuggling across border cannot really like look through the single lens. Next. Yeah, so as I say, like especially for the cross-border of Myanmar people, it cannot be seen by a single lens. Thai government sector, because Thai government sectors tend to always draw smuggling across border with organized criminal networks, including like human trafficking and smuggling network. So, and they often see that parts of organized smuggling network motivated by labor shortage among Thai entrepreneurs. However, Myanmar people who come to Thailand are not all victims of labor smuggling network. They also have their own purpose to flee Myanmar from economic recession after the coup, and because of the political situation after the coup, 2021 coup. And they were willing to look, they also have their own agency. They are willing to look for jobs in Thailand for better opportunity. And some people cross the border as family, bringing children and grandparents. Some of them sell off their properties and invest for a trip to Thailand. And brokers and trip leaders are not always like not well organized as criminal network, but some of them are facilitators in bringing Myanmar people to work in Thailand. And also, like a lot of migrants have overlapping status of being refugees, because the reason to drive them out of Myanmar is structural political crisis after the coup as well. And some of them fled their home because internal war. And this resulted the trade, because the situation back in Myanmar threat to their lives very, very significantly. Nonetheless, like Thailand doesn't have official channels for refugees, so everybody must enter Thailand as migrant workers. Okay, and then also like, and so apart from that, like some Myanmar people cross the border and use Thailand as a transit to work in Malaysia. And some came from Malaysia and traveled via Thailand to return to Myanmar. The policy prohibiting migrant workers movement in Thailand caused some of them to smuggle from Thailand back to Myanmar. And so that's why I say why Myanmar crossing the border could not be viewed by the single lens. Okay, next. And for Cambodian people who cross the border can be divided into two groups. So first, Cambodians who left Thailand to Cambodia. This group was found between June 2021 to the beginning of September 2021. So the main reason why a lot of Cambodian workers needed to smuggle across the border was the policy that Thailand imposed, the policy of no movement of migrant workers policy. So some of them wanted to return temporarily when there was no daily job in Thailand, or there was a lockdown in their workplace area. Some escaped from like severe Covid-19 outbreak in Thailand. I myself interviewed one Cambodian worker and found that even like this man, he was a documented worker. He had a full legal status, but he also needed to smuggle across border because he wanted to visit his family temporarily, and then he wanted to return back to Thailand for working again. So he had no choice but crossed the border illegally. And the second group of Cambodian crossing the border is like the Cambodian who travel from Cambodia back to Thailand so far increasingly since September 2021, because they wanted to find better opportunity of jobs in Thailand. And then the next one, the last slide, I like to show you like the smuggling was not limited to foreigners, because Thailand border closures and its policy on quarantine when entering the country may also made Thai people smuggle as well. Some of them returned to Thailand after entertainment business at the border in the neighboring countries were closed due to COVID-19, and others illegally left Thailand to neighboring countries to work for online gambling companies. And the news was still like there was. I found news yesterday like there was a warning from Thai embassy in Yangon to prohibit Thai people to smuggling across border to inside Myanmar and work for the gambling casino near the border of Shan State and China. So I mean, like this problem is still happening now. So all in all, we cannot simply criminalize the border crossing by informal channels, and that's all. Like, no, because there are several types of border crossing and also several reasons behind why they choose to cross border illegally. So thank you so much for your attention.
Okay. Thank you very much, Ajahn Sirada, for your presentation and also your report with the Migrant Working Group. I have a chance to glance over the report a little bit, and I have to say that it's like you compile the data very well regarding the situation about the workers, migrant workers, and in the COVID-19 situation. So now we're open for questions and answers. If anyone here would like to ask anything, you can raise your hand and I will allow you to, talk through Zoom. So I saw several of our faculty members as well who are interested in the migration issues and Southeast Asian issues. Oh, อาจารย์สุดารัตน์ค่ะเชิญค่ะอาจารย์ please.
Thank you, Ajahn Sirada. Can you hear me? Can you hear me okay?
Yes, ka.
Yes.
I wanted to ask if you can also speak a little bit more about now what is happening, especially because of the political situation happening in Myanmar and what is happening at the border. Maybe you know more about what's happening in Chiang Mai and the influx and the continuation of discrimination and lack of access now. Has it changed because, because of the influx of the political situation, ka?
To be honest, like I don't really as I haven't go to the border areas, and then I didn't do the field works, and also like now I am concerned about the COVID infection. So I myself don't go to the border, so I don't see the situations on the ground. Maybe if other people in this room have the information on the ground, you can share with me as well. But I think like I heard and I know about the situation that getting worse about the border crossing affected by war, affected by the conflicts, the armed conflicts inside Myanmar. You can see like not only in the past when I did the report, there were mainly reports from the cross-border cases were reported in Masot area, right? But nowadays, like you can see also the situation is getting worse in Chiang Mai province at the border as well due to the conflicts. But as you say, like as you can see, like because there are no channels for refugees, and there were no clear regulations for dealing with people who flee their countries, who flee Myanmar and find shelters in Thailand, right? So it's basically mostly depends on the depends on the management of local authorities and local staff, local officials, rather than the national regulations. So it's not clear like how Thai government would manage the movement of people from Myanmar in long term and in I mean like in the national level. So I think like the people have no choice but have to cross Thailand and become undocumented migrant workers. And I think it's the time for Thai government to see and find a long-term solution for this situation. I don't know if I answer your question. Maybe you have clearer answer than me as well.
No, I don't have a clearer answer than you, Ka. Ajahn, thank you. And based on your research, can you say a little bit more about the kind of recommendations that you think are necessary given the research that you did, and how receptive might the government be toward these kind of reforms and recommendations, Ka?
Yeah, for me, like I think like the implement what the government should do. For me, my main recommendation is like they might have to like restart the MOU mechanism and make the MOU to be kind of like more long-term effective and like open to more Myanmar people to have for them to have more channels to cross the border legally with documents, and that would help both, I think, both Myanmar people to find better opportunities for their lives, and also like for, I think it's benefit for Thai economy as well. If we apart from human right perspective, if we speak in terms of like national how to say, like national benefit, economic benefit of Thailand, something like that. I don't know if Thai government could do that, it would be better than what happening now. And also like for the refugees and for those who flee the country, to flee Myanmar and want to live in Thailand temporarily. Maybe Thai government should provide shelters more like concretely, and then also like open opportunity for them to stay temporarily and then go back to Myanmar when everything is truly safe. And to saying what means safe is also not only like okay, we cannot hear the bomb and then okay, you can go back to your country. No, I think it also depends on the decisions of the refugees as well. I mean, like we should distinguish people who fled Myanmar, who flee Myanmar into two groups, two big groups, like those who want only to stay in Thailand temporarily along the border, and they want to go back to Myanmar. Yes, there are a lot of people who think like that, who want like that, and also those who want to enter Thailand for finding jobs. So we have to distinguish these two groups separately and manage, and Thai government should manage differently. But also the location of you, how much receptive the Thai government may do. I'm not sure, because like I think a lot of sector, also academic people, we have pushed a lot of recommendations to Thai government, but also like especially civil society organization, they put a lot of pressure and recommendations too. But you can see like there are no many progress getting along well. Okay, ka.
Okay, thank you. I think next we have Ajahn Rosalia. Please, Ajahn Rosalia.
Yes, thank you very much. I think first to compliment you, because I think finally you bring to the table two very important perspectives, one on the issue of otherness and the other one on the fact that cross-border is not only migrants, but there are many Thai who actually are smuggled. And actually we have seen with the pandemic. And this brings me to my question and comment, which relates to the otherness, is often selective in the sense, actually the first patient, the first identified case was a Chinese national, but we have not seen much of an uproar or government comments on that. Western foreigner clearly have become a scapegoat at different point of the pandemic, also to justify the very strict border measures, and which today are not justified, but they're still kept into place. So why you think there is this strong focus on foreign? I mean, it needs to serve a purpose within the context of the COVID pandemic. You know, if you put the focus on foreign, not only migrants, expats and tourists and migrants, what are you taking the attention away from? You know, there is a trade-off, and I like to know your view about this. If you have any speculation on why is the Thai government so interested into framing a discourse based on otherness? That is the first question. And the second one on the issue of the people crossing border. We know for the one coming by air, there is very clear procedure in terms of quarantine. But what about the one coming by land? Because their number is much larger. Now, we assume that they have the same procedure, but frankly, I don't think it's feasible. I mean, I don't think it would be feasible to have applied 15 days of quarantine in hotels for people coming across the border by land. So can you tell me more what you know about quarantine measures taken during the pandemic for people crossing border by land? And the numbers of those, because the numbers are in the thousands, so much more than the one by air. So what happened to them in terms of quarantine?
So thank you for your questions. And for the first question, I like to say like the basic reason for Thai government that always frame the otherness of foreigners, migrant workers and foreigners, and also expat as well. I think the main reason is that they try to show that they could control the pandemic well, and all the I mean, like the otherness that we see that conducted by Thai government, directly conducted by government. I saw it during the first wave of the COVID and the second wave of COVID-19, not the third one. The third one is like much more less because the pandemic, as you see, like is getting severe across the nation. So why did the Thai government do? Because they try to gain trust from Thai people that Thai government could control the pandemic really well, and all the cases occur because of the foreigners, not us. We're not wrong. It's not our fault. It's not the government fault. It's all the foreigners that bring the pandemic into Thailand. It was the migrant workers who import the disease to Thai society. So, and I think during that time, in the first and second wave of pandemic, I think the government itself, Thai government itself, tried to getting more popularity, and they I think they thought that they plan to have the new election back then. I think they planned well because they getting more popular back then. But everything, like as you see, everything it ended. It ended when Thailand had began the third wave of pandemic. So I think it's also very political as well that they do this kind of thing towards foreigners. And this is the main reason, though. I think that there are much more other reasons, and then you can see like Thai people normally stigmatize and stereotype migrant workers before that, but does the Thai government re-emphasize and then reproduce that kind of alternates. And for the second question, I think that for those who coming by land, also during the 2020, 2021, there was a regulations for those who coming by land to quarantine as well. So it's shown in the government report that they did quarantines people, same as those who flying by through airplane as well. But the thing is that during the first second wave, and I mean 2020, 2021, the border was still closed. So I mean, officially there was no quarantine for those who crossing by land because the border was still closed. But if they found people crossing by land, for there was Thai people, right? So they need to quarantine as the same measure at the same period of time of those who cross who come to Thailand by plane as well. Okay. And other questions?
I think I have question from Ajahn Sakarin. Ajahn Sakarin, would you like to turn on your mic?
Okay.
Okay.
Concern.
You can ask the question. Ajahn, please turn on your microphone.
Okay.
Thank you.
The first question about the booster shot. I would like to know whether the government give them access to the booster shot to prevent or to reduce the symptom of Omicron. And on this, I asked 3 questions actually. Maybe you answer the first one first.
I'm sorry, I'm not sure about this question. Maybe if I think there are some CSO in here may answer this question well more than me. Yeah. But I think like basically like the plan of the providing booster shot, I think they focus much similar to the first and second, like they have to focus more on those who in tourism hub first, but I'm not sure about the other areas. Maybe others can answer this more than me. Yeah.
Can I add something? I'm not sure, but I saw that the Bang Sue vaccination center indicated that you can get booster shot regardless of your nationalities. But then I'm not sure when they say regardless of your nationalities, where is migrant workers in this? Because there are also expats, you know, PR, permanent residents, you know, people who are retirees, something like that. So yeah, we have to look in more detail about that, who is included. Yeah.
Yeah, thank you. So I will follow up on this one as well. Thank you for your question.
My second question is about the social distancing and migrant housing. From your findings, what would be your suggestions to solve this problem? I think this is quite serious because future diseases may also arrive. So we have to deal with this issue urgently.
I think like because the COVID situation was getting worse because like when one migrant workers infected, they had to still like stay with their friends, like. So I think basically like the best way is the base and practical way is like try to take the one who infected to stay outside their accommodation. I don't know if local authorities have a kind of like few hospital providing for migrant workers. Basically is that I don't know if they can do that, but it would be better if there this kind of like measures providing for them, because no way that they can stay in their rooms. Is too crowded, and then they cannot afford like wider places, wider space of accommodation is impossible for them. So, but I think like during the second wave of COVID and the early stage of the third wave, I think like the factories for those who work in factories, factories manage quite well, that they have their own measures and their own field hospital inside their workplace. It helped a lot. I think for those who, I don't worry much about for those who work for the large factories and middle-sized factories who have their budgets to do so. But I just worry about those who jobless or who work in maybe markets or who work for daily wage and don't have permanent employees. And this is the group that the most vulnerable among migrant workers.
That's the factory sandbox, I suppose. My third question is about the MOU channel. Because of many barriers and also increasing illegal immigration, so there are more calls for the government to lower the cost of MOU channel and reduce the bureaucracies. From your field work, from your interview, are there any positive responses on this demand from the state?
From the state, I think that they've been still negotiating on this, right? Because it planned for many months ago, but still not well effective, hasn't started yet. So I'm not sure. Like, I'm not sure about this question. I'm sorry, but as you see, like I think the main intention of Thai, the main purpose of Thai authority is like try to not import. they try a lot to not import the further migrant workers from country of origin. They just do this because of the pressure of the private sector, right? Because of the pressure from employers and civil societies. So they try a lot to like try to delay and then regularize those existing those already exist in Thailand. But I'm not sure like the technical process of the lowering costs, and yeah. And if you have more information on this, you can share now if you like to.
Okay, ขอบคุณครับ. Maybe we give opportunities to others.
Yes.
Thank you, ค่ะอาจารย์. I have a hand raised by คุณ Sunitra. Yes. You can ask question, please.
Thank you for giving this opportunity. It's really interesting research findings from Thailand. I actually a little bit wonder whether the role of MOUs, so you have mentioned that regular migration can actually a little bit have certain positive signs in terms of migrants' vulnerability. But when it comes to the irregular migration in Thailand, would you think so? If the MOUs can help in bringing the more migration regulatory mechanisms for the governing process, is if you can make better through the MOUs, I think it can help. But when it comes to the irregular migration, it is really I see from your findings, it's very difficult to governing process. Because you have mentioned that borders are already closed. So in that context, so how would you, the kind of mechanism that you could actually propose in order to make the regularize or just to facilitate these migrants providing necessary vaccination and how to provide much more, kind of facilitation. I mean, very effective mechanism, because when it comes to vulnerable migrants, we see that not only in Thailand, everywhere. So the hygiene facilities and all the living life environments are concerned. It's hard to actually keep social distancing. So then in that context, so it's how we can actually expect migrant to become more safer and secure environment. Even government also, would you think as a government, because it's even each and every government, it has certain costs associated with. On the other hand, it needs certain, kind of institutionalization mechanisms in order to facilitate such kind of facilities. Because most of the MOUs, if you look at, so those who were actually done before the COVID, but I wonder whether you have any sort of evidence to tell us that after the COVID situation happens, how the government changed their regulation, whether they had changed any MOUs accordingly to facilitate the migrant governing process. Thank you. Actually, it's really interesting.
Thank you for your question. I'm not sure if I understand the question quite well, but for the MOU, this MOU, I mean like when they like to restart, the Thai government actually like to restart the MOU. It means the MOU that kind of like special MOU. They call it special MOU because it came after the COVID-19, right? So they came with a lot of regulation regarding the quarantine and the vaccination process. And as like Ajahn Sakarin mentioned, there were the cost is quite high because it involved with the cost of quarantine and then vaccination as well. That's why this is the MOU that transform that is transformed from the normal MOU, which was effective before COVID-19. And the other thing is like, they would distinguish group of migrant workers into 3 groups, like yellow, green, red, like in terms of like how the vaccinations they already got, something like that. And they try to like balance, the Thai government saying like this MOU, we plan to like balance the health care of Thai society and the economy. So this is the newer form of the MOU. And I'm not sure, you asked about regularization in Thailand during the COVID-19, maybe. So I think like, because even like Thailand grant some amnesty to undocumented migrant workers, irregular migrant, and then also like regularize some undocumented migrant workers who already exist in Thailand, but still like there's a lot of problem in practice. I have a lot more detail in the reports of how the problems occur on the ground. And the main problem is due to the regulation, is the period of time, and then the regulations that force migrant workers that need, they have to find their own permanent employees, and also regarding the cost of the registration. So the amnesty policy, the regularization policy hasn't been fully effective due to this strict regulations, and also like they had to find hospital to check their health, to check that they don't have COVID, but it's hard. It's very difficult. It was very difficult for them to find hospital to do health checkup for them during the COVID-19 pandemic outbreak, with especially during the third wave, because the COVID situation in Thailand was really severe during that time, and hospital just kept refused to do other services apart from taking care of COVID patients, right? So it's hard for it's affect the process of registration as well. So I think that the best solution is to try to have come up, if Thailand want to regularize, they have to come up with flexible regulation, flexible period, and then they have to plan more, like longer term, longer term than what they have done, because every time like they come with like very ad hoc, very short term regulation, short term measures, and then people cannot really like prepare in advance, and that I think that may push a lot of migrant workers to be out of system, and that make the situation getting worse in terms of both controlling pandemic and both how to say, like in terms of like managing migrant workers in Thailand as well.
Okay, we already run out of time, but we also have, I think, 2 last questions. We have a question from Facebook. Is there a mechanism being implemented by the Royal Thai government in differentiating migrants from refugees?
No. They just see migrants like as illegal migrant, even those who fled Myanmar, who has fled Myanmar due to conflict, as mentioned. But for those who fled, maybe they have a kind of like mixed motivation. So they came with mixed motivation, and then they have overlapping status of being refugees and migrant workers. That's why, I mean, I don't mean those who stay along the border and then they express very openly that they want to go back to their countries. This is the different type of displaced person. For these displaced people who stay temporarily along the border, I think like that a lot of Thai local authorities already take care of them, but no policy at the national level that clearly clearly address about the problem yet. But for those who want to come and stay in Thailand for longer term, yes, for Thai government, in the eyes of Thai government, they don't have they don't differentiate between refugees or those forced migrants and those who are economically motivated migrant. Yeah. So this is like a term like illegal migrants. That's all. Yeah.
Yeah. I think Sudara might want to say something. Maybe short comment and questions.
Oh no, I think it would be really great to have a longer session, but I want to respect the time. But I know that one of the things that sometimes we rely too heavily on MOU to solve problems, but MOUs are non-binding, and it really depends on the national society itself, right? To what extent are they going to allocate more budgets toward COVID and health safety, or fair labor processes, or labor inspections? So I think that the MOU angle for the context of Thailand is really limited. And I think it's really about the kind of governmental reforms of comprehensive immigration reform, shifting from the security state mindset, right, into thinking about what does it mean to have ASEAN cooperation for low wage, the demand for low wage migrant workers. So I was wondering, maybe you could wrap it up, thinking about what are the shifts, in that way.
I think this is the most important, right? I mean, the security mindset that Thai authorities, Thai government should change a lot about this mindset, because it's also affect so many stakeholders in Thailand as well, not only the migrant workers themselves. And yes, you point you addressed the point very, very well about it. Like MOU is not non-binding, and then we need some the more comprehensive mechanism to deal with regulating or importing the migrant workers from neighboring countries, right? But I think that there's also the other thing that we had to consider, because when we have some kind of like corporate labor bilateral cooperation right now, we have another concern about the bureaucracy inside Myanmar. Yeah, and also like so that means like Thai government had to deal with the Ministry of Labor in Myanmar, which is under Tatmadaw, which is under SAC. So it is also the other concern of me about like the kind of like the political implication. But yes, we have to look at the lives of people. The lives of people should be the first priority, right? So we may, but we may also have to concern about the political implication as well. But I think like it's maybe Thai government can do this unilaterally. I don't know if the effectiveness inside Myanmar, effectiveness of Myanmar bureaucracy is not going well, and then also like in terms of like the political implication, if we concern about this, I think maybe Thailand can come up with some unilateral management. Yeah.
Many people are asking for a copy of the report in the chat. I don't know if you can, Ajahn Kip, if you can share screen in the chat.
I think
Kun Bom posted some
posted
links.
already. Yeah.
Yeah. But if it can be posted in the actual Zoom, then that way when people look back on the Facebook, they can maybe access it. Thank you. And maybe if Ajahn Kip wants to announce the next one. Yeah.
I think we can post the link of the report on Facebook, our Facebook at SEA Junction, and also IPSR Facebook as well.
Yes.
Thank you, Ajahn Kip.
Done even before the don't worry.
Yeah. Can I also publicize next month's events from IPSR in-house seminar a little bit? So next month we will have 3 in-house seminar, which coincidentally about migration. All 3 of them about migration. So next week we will have the Transnational Lives of Urban Refugees in Bangkok by Dr. Mary Rose at AIT, who is currently working at IPSR as well. And also March 16, we have me and greet Mahidol Migration Mobility Scholars. And also 30th of March, we have how NGOs contribute to the Trafficking in Persons report, Thailand's migrant workers. So very similar to the topic, and I think it will be very interesting if we can all join. We have followers from IPSR and followers from SEA Junction. Everybody's welcome. You can follow us on Facebook to learn more about the time and the link. And also, I think we will have Wednesday SEA Mobilities again in April, and we will update you on the speakers and the topics, and these will be publicized on both IPSR Facebook and also SEA Junction Facebook. So make sure you follow us and learn more about our news. Thank you very much, everyone.
Thank you.
Thank you very much. Thank you.
Thank you.
Thank you to organizers. Thank you.
Thank you.
See you next time.
สวัสดีค่ะ
สวัสดีค่ะ
สวัสดีค่ะ